Osteoarthritis affects 1 in 5 adult dogs and is the most common cause of chronic pain treated by veterinarians. But while 8 million dogs have OA, less than half receive treatment. One simple reason is that signs of OA can be subtle and may be overlooked by busy dog owners and practitioners. In a recent survey, only 17% of veterinarians reported they regularly check for arthritis during routine physical exams. But identifying dogs with osteoarthritis pain is simple, easy, and fast. In fact, about 5 minutes is all it takes. With routine screening for OA each time you see a patient, you can detect this progressive, degenerative, and painful condition in its early stages. And early diagnosis means you can intervene sooner with a comprehensive arthritis management plan that includes diet, exercise, and pain management. During this program, veterinary orthopedic specialists Brian Beal and Stephen Fox will demonstrate simple, fast techniques you can use to screen your canine patients for osteoarthritis. The first step in OA screening is the same as for any other exam: taking or updating the patient's medical history.
Or he goes for a while and then starts to tire?
It takes a little longer. On the longer walks is when he tires.
Okay. Is Chief reluctant to climb stairs or reluctant to jump into a car?
This is a good time to ask clients if they've noted any signs of arthritis, such as limping, difficulty climbing stairs, lagging behind, and appearing stiff after play. And if clients have not reviewed an arthritis checklist, such as this one available from Pfizer Animal Health, this is also a good opportunity to walk clients through the questions on the front of this helpful form. This first step should also include observation of the dog's general appearance, demeanor, relative weight, and body conformation. Look for decreased weight bearing or trembling, asymmetrical swelling of a joint or soft tissue, muscle atrophy, and misalignment of digits and joints. The next step is to observe the dog's gait for lameness. However, keep in mind a dog may not exhibit mild lameness in the hospital setting. If you think it is appropriate, observe the dog at a walk and trot, since lameness may appear during one gait but not the other. Watching the dog travel up and down steps and move to and from resting positions may also help identify a problem joint or limb. At this point, you may want to rule out potential neurological problems by checking the dog's conscious proprioception or palpating the spinal column. During the upcoming steps, limb palpation and joint manipulation are performed. The intent is to elicit signs of pain if osteoarthritis or other musculoskeletal disorders are present. Signs of pain include vocalization, changes in facial expression, and increases in respiration and heart rates. Before you begin, advise your client that the dog may experience brief discomfort. If discomfort or pain is noted, you have a natural opportunity to educate clients about the painful nature of arthritis.
So we start with the carpus by flexing and extending the carpus, possibly a little deep digital flexion or palpation here. We put it in valgus, feeling the medial collateral, varus to feel the lateral collateral, work our way up the limb, palpating the muscle groups. When we get to the elbow, again, flexing and extending the joint, putting it in valgus and varus deformity, palpating the collateral ligaments. The elbow we want to put in hyperextension to see if the dog is painful. And then we also want to use our middle finger to palpate that medial coronoid area to see if we elicit any discomfort. Then we come right up to the shoulder. We want to put it in a flexed position and then also put them in an extend position, being careful that we're not putting our hand behind the elbow to hyperextend the elbow at the same time. And then when we go to flexion of that shoulder, we might also palpate that bicipital tendon origin for any discomfort.
We will now perform an examination of the hind leg. And when we examine the hind leg, initially we look for muscle atrophy, signs of muscle swelling. Then we go on to palpate the shafts of the long bones to look for signs of pain that might indicate panosteoarthritis. The next step would be to evaluate each joint for range of motion by fully flexing and extending, also checking collateral ligaments by doing a varus and valgus stress. In the stifle joint, we also flex and extend to evaluate for pain. We do a valgus and varus stress. We also will evaluate the patella to check for patella luxation by pressing on the patella medially and then laterally. To evaluate the cruciate ligament, we can do a tibial compression test by flexing the hock. And also we can evaluate this ligament by doing a cranial drawer test. The last joint we'll evaluate is the hip joint, and we'll assess this joint by extending the hip, looking for pain, and flexing the hip. We also want to go ahead and test for abduction for pain. And then finally, we finish up by palpating deep inside the pelvis to look for signs of muscle pain associated with an iliopsoas tear.
That's all it takes to briefly examine a dog for osteoarthritis. During this simple screening, you may find manipulation of one or more joints elicits a painful response. If so, you may wish to evaluate the joint further with the patient under heavy sedation or anesthesia. A demonstration of 3 procedures by Drs. Beal and Fox can be found immediately following this program. Once osteoarthritis is diagnosed, a comprehensive management program that includes diet, exercise, and pain management can be implemented. This approach reduces joint stress, strengthens joint-supporting muscles and ligaments, and relieves pain and inflammation. Let's quickly review the simple steps to screen for osteoarthritis. 1. Review the patient's medical history and assess overall condition. 2. Observe the dog's gait and mobility. 3. Palpate the forelimbs and manipulate the joints, watching closely for signs of pain. And 4. Palpate the rear limbs and manipulate the rear limb joints, again, watching for signs of discomfort or pain. Taking just 5 minutes to add these 4 simple steps to your routine physical exam will help you detect OA in its early stages, avoiding unnecessary discomfort and pain for your patient. By relieving arthritis-related pain and restoring mobility, you can improve your patient's quality of life and restore his active place in the family. The simple screening just demonstrated is a valuable tool to help identify lameness and other signs of osteoarthritis pain. If a painful response was elicited during joint manipulation, you may wish to do further evaluation. Here again are Dr. Brian Beal and Dr. Stephen Fox to demonstrate 3 additional tests: the Ortolani test for hip joint stability, and the cranial drawer and cranial tibial thrust tests for stifle joint stability.
During your basic OA exam, you may find that one or more joints are suspect by having the animal show some discomfort or pain during the examination. If that's the case, it'd be appropriate to further assess that joint under heavy sedation or anesthesia and perform such operations as trying to elicit an Ortolani sign or doing an anterior drawer to further isolate that joint and the problems therein.
With that in mind, let's go examine a dog with hind limb lameness under anesthesia. Complete evaluation of the hip requires an Ortolani test. This test is actually performed under general anesthesia or under heavy sedation. This test actually tests for hip instability and is done either with the animal lying in lateral recumbency or in dorsal recumbency. The test is performed by placing axial pressure or pushing against the femur and subluxating the hip. As you do this, you maintain pressure and then slowly abduct the hip while stabilizing the pelvis, and you can see a popping, which is actually the hip moving back into the socket. So again, we push on the leg, we abduct the leg, and then we get the pop, which is the head popping back into the joint. And this indicates that this hip is unstable. Evaluation of the stifle oftentimes is best accomplished under sedation or general anesthesia. This is because some of the manipulations can be painful if they have problems. One test that's very useful is assessing for cranial drawer. And in this test, we place our thumb on the fibula, our finger on the patella, then we place our thumb and forefinger around the proximal tibia, and we try to move the tibia cranial in front of the stifle in this manner. If the ligament is ruptured, the movement will be exaggerated, indicating the ligament is torn. Another test that we commonly use is something called a cranial tibial thrust test. And in this case, what we're trying to do is mimic the animal's weight bearing. And as the animal bears weight and flexes the tarsus, there's a tendency for the tibia to move in a cranial direction. If the ligament is intact, however, that holds the tibia back. But if the ligament is torn, then we will get a cranial movement of the proximal tibia.
Whether anesthetized for a dental prophylaxis, radiography, or surgery, the unconscious patient presents a natural opportunity for you to quickly check for osteoarthritis. By detecting OA in its early stages, you can help your patient avoid unnecessary discomfort and pain, and provide quality care through all stages of life.